How long does end-of-life care last? When we think about end-of-life care, a common question arises. How long does it actually last? The duration can vary significantly based on several factors. End-of-life care includes both palliative care and hospice care, each with its own timeline. Palliative care focuses on relieving symptoms and improving the quality of life for patients with serious illnesses. This type of care can start early in the illness and may last for weeks or even months. Research shows that the median duration of palliative care before death is around 34 days. However, this can differ widely. For instance, younger patients, particularly those under 50, often receive longer palliative care, averaging about 29 days more than older patients. Patients with cancer diagnoses usually receive longer palliative care compared to those with non-cancer conditions. Additionally, the setting plays a role. Patients referred to community palliative care services tend to receive care for a longer time, with a median of 46 days, while those referred from hospitals may only receive about 20 days of care. Now, let's talk about hospice care. This is a specific type of end-of-life care for patients who are expected to live 6 months or less. While hospice is intended for those with a limited prognosis, many families only choose this option when the patient has just days or hours left to live. The median length of hospice care is about 17 days, but the average length can be longer, around 92 days for patients covered by Medicare. Studies indicate that patients who receive hospice care for several months often experience better quality of life and emotional benefits for both themselves and their families. From an ethical standpoint, the timing and duration of end-of-life care raise important questions about respecting patient autonomy and cultural values. Different cultures have varying beliefs about death and dying, which can influence when care is initiated and how long it lasts. Some cultures may prioritize extending life at all costs, while others may focus on comfort and dignity in the dying process. Ethical end-of-life care involves clear communication about prognosis and care goals, honoring the wishes of patients and their families, and providing support that aligns with their moral and cultural values. This might mean starting palliative care earlier to enhance quality of life, or enrolling in hospice care in a timely manner to ensure comfort and dignity in the final days. In summary, the duration of end-of-life care can range from a few weeks to several months, depending on various factors. Understanding these differences can help ensure that care is tailored to support the dignity of the patient and meet the needs of their family throughout this challenging time.